Hey everybody, this is Matt Valosen at the Bone and Joint Institute of South Georgia. Just wanted to reach out to you today to do a little information video about where we are at in this pandemic. I hope that everybody is doing okay. You and your families are staying safe during this, staying sane during this quarantine. We're doing our best to try to provide the care that we can here at the Bone and Joint Institute, and thankfully we're now at a stage where we can get into some transition back into normal. So I just wanted to go over with you some of the things that are important during this transition back to normal as far as obtaining care here at our offices. The most important thing is protecting you as the patient. Some of the big things as we make this transition, as you start coming into our offices, coming into the surgery center, into the hospitals, is protecting yourself. Number one, hand hygiene. Make sure we're washing our hands all the time. Be cognizant of what you're touching, things that you're touching your face, things like that. We want to make sure that we limit anything that can do the spread of the virus, which is what we don't want to do. You can expect a lot of screening questions, whether whenever you call the office or whenever you arrive at the office. Do you have a fever, chills, cough? Have you been out of the country? No one's really out of the country right now, but just be patient with us as we ask these questions, as we're just trying to gain information so that we can keep everybody safe during this transition. Strict social distancing, strict no visitor policy. We want to minimize the ability for this virus to go from person to person, and keeping that social distance and minimizing the number of patients, visitors that come in and out of the clinic is going to be very important during this time. So don't anticipate having anybody come in with you during these visits, so that we can minimize that number, and also the distance 6 feet between you and another person. The last thing as far as the patient protection is going to be important is everybody in the office is wearing a mask. We're all wearing our homemade masks. And we want you as patients, whenever you come into any facility, to be bringing your own homemade masks so that we can protect each other from the spread of this virus. So how are we going to be doing this phased reopening? Basically, all of our satellite clinics on Monday, May 4th will be open. We're going to be doing some scheduling during those days that will help us to move through the flow of patients, test some of these parameters out, and see how we can most effectively do that. With the anticipation of May 11th, we will be back as close as possible to normal as we can as far as our clinics. If you are still unsure about wanting to come to one of our clinics, we are still offering the telehealth visits. You just have to have a smartphone, a computer, and just tell the folks whenever we schedule your appointment that you would rather have a telehealth appointment, and we will walk you through that. As far as surgeries, as you can expect, there's a backlog from the elective surgeries. We have a good plan in place, and we're going to start scheduling those surgeries back. We've got a good plan based on the type of surgery it is, the acuity of the surgery, and basically the availability to get the surgery done safely. So just be patient with us. We have a good plan, and I assure you that we're going to try to get every patient taken care of with the best possible safety in mind. That being said, there's going to be a lot of things that look normal, but there's going to be a lot of things that still aren't normal, and we would just ask for your patience during this time. We assure you that your safety is our #1 priority, and we look forward to seeing you all back in the office soon.